request, or what we will take as what we are putting on the table as what we want, or what we are requesting for. So in the first step, we want to acknowledge the work that the ministry is doing with respect of providing care to victims of GBV. You may not be doing that directly, but I know that you have agencies and departments under you. You are the headquarters, but across the Federation of Nigeria, there are so many agencies under you, and you are reaching out and doing, seeking to deliver on the various mandates of these agencies under you, who also captured under the ministry. But coming down to one listing out the points individually, let's start with the first point on the issue of Section 11, subsection 3 of the National Health Act. Essentially, that is speaking to the activation of the 5% emergency fund, which is the money from 1% consolidated revenue fund. So according to the National Health Act, 5% of it is to be used for emergency care services. So, and a committee to be appointed by the National Council on Health is to oversee this. So we are advocating that that particular provision, whatever activation that needs to be given on that front, for it to take off, and even us as CSOs, what do we need to do? How can we support that particular process to take flesh? We are all listening to see how we can support that from your end. Secondly, we want to provide, we are looking at how we can provide more support to the public and private health facilities on GBV response. So these other agencies that are already seeking to deliver on their mandates, how can the ministry more or less looking at interagency collaboration, how their work, how does it, where does your delivery of your mandate and the delivery of theirs have an intersection? How can you support them, and how can they also come to you in any way they need to get the things they need to deliver on their mandate? Next, establishment of GBV response units in all hospitals. We know that at this point, most of these hospitals would have in instances where this is not done, or this is yet to be done, we are advocating that it be one of the points that in the light of the objective of the project, that more funds, of course, be channeled to that light so as to alleviate the plight of survivors of GBV. Just that third point, of course, is linked to the fourth, talking about inclusion of a budget line. And we know that the budget is a very robust document that would need a series of review before it becomes a law. So as this process is ongoing now, we are aware that the 2023 budget process is already underway. So maybe this would be a platform to just raise that point for it to be taken forward. Next is for us human resource for health, personnel's on protocol guidelines, essential service package for GBV. So we are looking at also how can this be achieved. We know that the budget speaks to all of this, and more often than not, lots and lots of items are demanding for resources in the budget. So if there are ways we can also see if this can come in the ranking of things, so that resources get also to training of these personnel. And as we've spoken earlier about data, this is also an angle of it: ensure proper collection, storage, and documentation of specimens. So when these issues happen, rape issues, domestic violence issues, and all of that, there are steps and ways these things are done. So whichever of the agencies domiciled under you that deliver on this mandate, if there are ways they can also get some amount of resources allocated to them for them to scale up what they are doing, is the point being made by that bullet point. Of course, the next one is psychosocial support. These victims, they need rehabilitation and all of that services along that line. So this is one of it, and if it's something that can be accommodated under you, then that's fine. If not, the agencies under who are delivering on this mandate can very well be reached out, or even given some resources to scale up what they are doing. Standardization and regulation of hospitals. We cannot overemphasize on this, as these are everyday activities or everyday services that every other citizen, aside even GBV, as in gender-based violence, there are a plethora of health services that we know that would need more some sort of standardization. Now, referral centers may not be under your purview, but these are essentially, all of these points are essentially what are related when you're discussing gender-based violence. So, about getting victims, addressing their needs, giving them the services, the support services they need, and also providing shelter. We know that the other stakeholders you mentioned in the beginning, that all of them have a role to play in this process. But we coming here today is essentially to see how the delivery of your own mandate intersects with their own delivery, and how we can have better interagency collaboration. How we can foster better interagency collaboration in combating gender-based violence in looking at the grand scheme of things. And